I hope you guys are happy. This is your second last class. I want to say your last class, but I can't, unfortunately. We still have malaria left after this. But this is at least is easy work and interesting work. That's also why I leave it for the last class. And my chair is very squeaky. Hopefully you can't hear that. Okay, so this class will be around helmintic infections. So we have quite a wide variety of helmintic infections. So all of these helmintic infections I'll be talking about are living organisms that want to live inside of you. They see you as the ultimate habitat. So in a certain sense, you can think of people living in a certain country, and these people want to move to a different country, and then they move to this different country and live there as well. This is basically what these elements do. They're living somewhere in some animal, and they get expelled out of this animal, and they want to enter into a new animal, and this new animal is you. So maybe a bit of a crude way of putting it, but that generally is what they do. They see you as a habitat where they can live, copulate, um, reproduce, and continue living, well, for as long as possible. And then they let their little children go out into the world, little eggs or little small worms, etc. And then they infect new people, more people, until everyone gets a worm. You get a worm, you get a worm, everyone gets a worm. So we call them worms, but in essence they're actually helminths. A little bit different to worms, but they look like worms. No, very different to worms, but they look like worms. So that's what we're talking about today, helmintic infections. And my little comment there is brace thyself. There are a few disturbing images, and these images, well, I think they're educational. Anyways, so where do we start? Let's start with helmintic infections. So in South Africa we have, well, let's say about 20 or 15 specific helmintic infections that we do get, but in general there are hundreds of them. So there's about 350 helmintic infections that we can find in humans, and most of them tend to go for the gastrointestinal tract, and then they live in your gastrointestinal tract. So they are parasites. They are feeding off of you, your blood, or they are feeding off of the food you eat. So let's quickly break down the two major groups. The major groups we have are the roundworms, the nematodes, nemahelminths, and then we have the trematodes, the flukes, the cestodes. These are called the platyhelminths. So the one side you've got roundworms, otherwise you've got, well, tapeworms, flatworms, however you want to call them. So I think the easiest way to remember them are nematodes and cestodes. So roundworms and tapeworms. Okay. Infections mostly occur because of poor hygiene practices. So if you have these worms living inside of you and you go poop, these two worms just had a romantic evening inside of your colon. So if you go poop, that poop of yours contains the offspring of that romantic evening. And that offspring must now be eaten by the next person or by an animal like a host, what do you call it, a carrier. Like carrier could be, for example, a pig, could be a what's the thing, cattle, could be cattle, could be a dog, could be a cat, various different animals, could be our middle what's the right word, our carrier medium or carrying around the parasite until it has another opportunity to infect humans. But also a lot of the helminths can infect either an animal or a human. So we're sharing them in a certain sense. There are also a lot of different helminths that actually don't infect humans, but infect only cats and dogs, or infect only pigs, or infect only cattle. So since we are slightly different, there are a few that don't really come over to us. But the ones that do come over to us, all of them share similar characteristics. So living in your gastrointestinal tract, and usually they are spread through fecal containing water, or water containing fecal matter, and in that fecal matter you will find the little egg, or the little larvae, or the little, what's the different one we could also call it, I can't remember. The larvae is, it's not a larvae itself. A cyst, yes, little cyst. Inside that cyst you find everything the worm needs to start growing. Okay. Mostly they enter into you via dirty drinking water. That's the easiest way they enter into you. It can also be by uncooked meat. So, but the uncooked meat is not always the case. In some cases, yes, but not always the case. So I have a few examples here for you. We call these cystosarcosis, and these cystosarcosis are in meat. So here's an example of Taenia solium. So Taenia solium is a tapeworm that we get from pigs. So this is actually pig's meat in this image. And you can see all of those little bumps, these bumps, all of those little bumps are little cystosarcosis. So these cystosarcosis are basically little babies. So little babies of the tapeworm. And if you do not cook your meat, you'll be ingesting that. But you can generally see a cyst like that. But normally cooking meat will kill all of them. So just make sure you cook your meat. That's one of the ways it enters into us. So through eating a cyst accidentally, or drinking a cyst through water, or drinking. It's not a larvae. That's the wrong word. I'll get to that word later. But generally speaking, we ingest the little parasite, the little helminth, and then we get the active infection. That's one way. Some of them can also distribute into us through our skins. Now, it sounds like sci-fi kind of things, and it actually kind of is sci-fi kind of things. So, there are two of them, Ancylostoma duodenale. There are three of them. No, yeah, I think it's three. Ancylostoma duodenale, Strongyloides stercoralis, and I think Ascaris lumbricoides as well, but I'm not sure about the last one. They can basically enter into your body through your skin. So if you accidentally, with your bare feet, step in poop that contains Strongyloides stercoralis or contains Ancylostoma duodenale, one of those two nematodes, then it actually can enter into your body. Doesn't have to be poop; it can also just be dirty ground. So it's easy to get them. It's not just about eating dirty things. You can actually accidentally get them by just stepping on them. There are actually also a few. I can't remember their names now, but the names will be somewhere in here. But there are also a few worms that actually produce such tiny little eggs that those eggs can drift around in the air, and you can actually breathe them in, and they can actually breathe inside of your nostrils. So, not your nostrils, a bit deeper, in your sinuses. And then as soon as you have like a little postnasal drip, or you basically have a little bit of phlegm and you swallow it down, you've basically taken this egg and swallowed into your body. And now it can start breeding and going through all of its life cycles there. Okay. So generally speaking, humans, yes, we are the primary ones, but there are thousands different parasites out there, thousands of different versions that can infest different people, etc. Or not different people, different species, etc. In South Africa, we've got a few we're focusing on, and that's what I'm focusing on. But there are many, many, many more in different parts of the world. So keep it in mind. Even if you think you know helminths, there are always more that you don't know. Okay. Yes, so in some cases the egg cysts or larvae may persist in human host and become incised, covered with granulomatous tissue, giving rise to cystosarcosis. And that's exactly what this is. Where is it now? These are neurocystosarcosis. So there's a bit of a fibrous tissue surrounding it. So your body has covered off this infection here, but now they're basically just a living organism waiting in wait until they reach the right environment, and then they'll start breeding there. They don't actually start breeding out in the muscle here, but when ingested by a different animal or by us, we slaughter a pig and eat the pig, we can actually get this into our bodies then. Okay. Few more things I want to mention. Yes, so approximately 20 helmintic infections are considered clinically significant. And this also actually varies from region to region. You get different infections in different parts of the world as well. So yes, this is an oversimplification at the same time as well. Okay. Okay, so first of the one I want to speak about are the tapeworms or cestodes. And we really have two main ones in South Africa. So we have Taenia saginata and Taenia solium. So Taenia saginata is the one you'll find in cattle, and Taenia solium is the one you'll find in pork or in pigs. So basically, these live in pigs and in cattle, but not like always. They don't always live there. They have to be infected with them first, and then in their life cycle, they will copulate, and then they will go lay their eggs somewhere in that meat, actual meat. So they actually have an ability. I'm not sure if it's actually them that travel through the blood supply to the places or to the periphery, like the muscles itself, or it's their actual offspring that get there. But anyways, it doesn't really matter so much. They still have the ability to make little cysts of their larvae inside of the animal's meat. So these ones you generally get by ingesting fecal matter of a pig or a cattle, which can happen if a pig or a cattle poop in a river and you drink from that same river. It might even be further down and the water might seem very clear, but the little cyst can still be in that water. Or by eating undercooked meat, and then you actually have this little cysticercosis living in the meat, and if the meat was not cooked well enough and this cysticercosis wasn't destroyed, you ingest the cysticercosis and you get Taenia solium or Taenia saginata. Okay, so like I told you guys, pigs and cattle, and then usually when you get these infections, you are asymptomatic. Very long-term infection with Taenia solium gives you something called neurocysticercosis, and seen a few of these in practice actually. So if you have a long infection with Taenia solium, I'm talking about years, you can actually get to a point where you have not the virus, the parasite actually entering into your brain, and then it's starting to live inside your brain and making little cysts in your brain. And you can go look at an X-ray image and you actually see the little neurocysticercosis, those little collections of cysts in the brain itself. I think I'll search for images now and show you one example. And these patients will then present with all random kind of symptoms because it almost looks like a tumor in the brain. In terms of the pressure that's being added and all of the inflammatory processes that's now started in the central nervous system. It's actually very difficult to treat this if you actually get to this stage. So if you just got treatment much earlier, you would have most likely been fine. At this stage, I think these people actually have to go undergo surgery to remove them, or you simply kill them and they live there, and then your immune system slowly breaks them down. But don't take my word on that one. I haven't actually gotten that far in treatment with treating a patient with anything that severe, but you can completely avoid that by treating them ahead of time with a very simple antibiotic. Not an antibiotic, an antiparasitic actually. Okay, so then I have a few examples for you here. And just hold on to your socks, people. These are all real images, so these are all real and living. Here's an example of Ascaris lumbricoides. That's a kind of roundworm, a nematode. And they usually enter into your body. I think it's via actually eating them accidentally, but I also think they can actually enter through cuts and scrapes as well. So they enter into your body via little cysts, so little eggs, and then they spread. Most of them, they tend to stay in your colon, some in your gastrointestinal tract, and then they feed in your blood and feed on other matter. But it depends on what worm it is. So some worms would actually live on your bloodstream, so they would actually eat your blood like a little vampire, and then they can actually cause anemia long term as well. But most of them, as far as I can remember, actually live on the things you eat as well. Then you can see an image here of a nostrils and a mouth, and then this is also Ascaris lumbricoides. So in the life cycle of this little monster, it actually ends up leaving your gastrointestinal tract and crawling upwards. It has to do with your... Almost ended up making a dire mistake in that video there. Anyways, this little Ascaris lumbricoides worm, or I should probably not call it little, that's not little. Anyways, it has this insidious life cycle. So when you actually ingest it the first time, you get this little parasite in your stomach, and then from your stomach or from your gastrointestinal tract, it starts the larva itself. It hatches into the larva itself, and then the larva itself can actually move into your gastrointestinal tract's blood supply, and then from your blood supply, it finds or it gets spread everywhere most likely. But the one area where it sits and stays is the alveoli. And then it starts maturing in the alveoli until eventually it bursts out of the alveoli. So at that point where it actually bursts out of the alveoli, you'll be coughing up blood as well. Not insane amounts, but a little bit as I understand it at least. And then it actually moves from your lungs to your trachea and then up to your esophagus, and then you swallow it. And then as soon as you swallow it, you swallow now this little worm. And this worm, and this can all be happening without you knowing it. So it's not necessarily that you have these massive worms doing this. It could be very small worms at this stage as well. And you wouldn't even know this is happening. So you don't necessarily have to have an insane amount of symptoms with this. Anyways, then as soon as you've swallowed it, it reaches the gastrointestinal tract, and then there are male and females there, and then they start having copulation once again. They make more eggs, and then this whole cycle repeats and repeats and repeats, and the next person and the next person and the next person. I would not ask you guys to be able to repeat any life cycle of any worm, but I want you to understand how all of the worms more or less work. So the Ascaris lumbricoides is kind of a favorite of mine just because it does this insane pathology that can actually reach the lungs from your gastrointestinal blood flow. That's why I kind of put some emphasis on it, because it's interesting. But in general sense, all of the helminths and the nematodes, the cestodes,
Even the single-cellular organisms like Yardelamblia, that's not the one. There's another one, Histolytica. I can't remember its name. I hope I have it somewhere in there as well. They all spread through the same mechanism. So some egg or cyst gets pooped out, feces, and then this gets consumed. And once this is consumed, it breeds or starts hatching and breeding in the gastrointestinal tract. In the case of Ascaris lambrigoides and Strongyloides stercoralis and Ancylostoma duodenale, they actually have a blood supply thing about them as well, and they can actually enter the body in a different way as well. But generally speaking, they live in the gastrointestinal tract, in the colon. You poop out the eggs. The eggs are everywhere. You can't see them. The eggs are consumed again, and then the entire process repeats itself. So it's almost a community approach that you have to fix these kinds of problems. I mean, it's actually a problem with sewage, a problem with not having clean water, not having a working toilet and drainage to actually take away these infectious materials, and then they can stay in the community for much more longer, and then people can reinfect themselves with it. So that's actually the main problem, and that's the main problem with most of these parasites. And that's kind of a sweeping statement, but that's generally what happens in most cases. Most cases you can.
Okay, and I've forgotten to put the mic on again, so now it's on this time. Hopefully we can continue. I can just continue without actually making myself crazy. Anyways, the next section I want to get to, not really the next section, we're still on the same section. I want to show you a few more examples here. The only one I really want to focus on still is over here. So here you can see some, I'm not sure which one this actually is, Taenia saginata, Taenia solium, or Ascaris lambrigoides, etc. I'm not sure which one it actually is. But you can see this is basically a colon, and you can see the worm living in the colon. And then they have these little heads, these little jaws on their heads, and they can cling onto your mucosal, onto your gastrointestinal mucosa, and they can just stay there. They don't want to leave. Okay. I've hopefully scarred you enough. Hopefully you remember things if I've scarred you that much. The next one I want to show you here is around, what do we call this worm? Enterobius vermicularis. Enterobius vermicularis. It's also a nematode. It's also a roundworm. And it lays these insanely tiny eggs. You can see we've basically we have a what do we call this, a microscopic image here of the tapeworm eggs. All the tapeworm eggs. Enterobius vermicularis legs, nematode. It's a nematode. It's a type of nematode. So you've probably heard of perianal itching. Perianal itching is a main symptom of Enterobius vermicularis. So these worms, as soon as you go to sleep, when your body temperature changes, they want to go find a hotter climate. So they migrate to your anus. And then once at your anus, they start laying the eggs in. The eggs are insanely small. So as soon as a child or a person scratches their butt, they scratch these little eggs loose, and they can actually drift in the air. And then you can breathe them in, you can swallow them through your sinuses connected to your epiglottis, and eventually everything moves backwards, postnasal drip area, you swallow, and then goes to your gastrointestinal tract. So you basically infect yourself that way. So if one person in the family has this infection, everyone in the family most likely has this infection. Not a very difficult thing to treat, not benign. What's the other one? There's a benign and the bad one. It's not that bad for you. Like, I mean, it has bad symptoms and it's irritating, but it's not deadly itself. But these little white dots you're seeing here are actually the worms, and you also see these worms on animals as well. So a lot of cats and dogs also get the same one. And very tiny eggs. Eggs can go everywhere. And we also get something called auto-inoculation with this. So people actually give themselves the infection over and over. So people will scratch their butts, and then they would scratch their nose, and then they would actually have given themselves another infection. Okay, so yes, not much comment on that. Okay, the nematodes, I've basically mentioned a bunch of them just now. You see here's a microscopic image of one of their heads. I'm not sure which one this is, but you can see they've got these little vicious claws, or not vicious fangs, to them. So they take a hold of your gastrointestinal tract mucosa, and they do not let go. They want to stay there. This is the ideal home for them. Here are all the examples. The ones that we have in South Africa are Ascaris lambrigoides, yes. Enterobius vermicularis, this is the one I just spoke about, the one that travels in the air. Trichus truguria is a type of whoopworm. This is also a worm that over a long period of time can give you something called erectile prolapse. So let's not go too much into that. Hopefully it doesn't happen, but trichis can actually damage all of the little binding tissue around your rectum. So your rectum you can actually accidentally poop your rectum out in a certain sense. I'm oversimplifying it not much, a lot. So don't take my scientific terms for that. I'm not an expert on the anatomy itself. But trichostrochuria it's kind of a pathognomic trait of it. So it's one thing that's really very specific about trichostrochuria. Strongylosis stercoralis, we have some of in South Africa as well, and this is the one that can enter into through your skin. So a cut on your skin or a little bruise on your skin, and then you have maybe a bruise on your foot, and you walk over some poop or some soil infested with feces, and then you can get it. And then this is the one we get in dogs a lot, Necator americanus, very similar to Ancylostoma duodenale. But Ancylostoma duodenale is the one that dogs get and humans get as well. And this is the one that can spread also through little cuts and bruises in your skin, and then it actually enters in your bloodstream and goes around and around and around, eventually gets to the lungs. So the alveoli bursts out, walk upwards or crawl upwards, or your cilia carries them upwards, and then epiglottis is swallowed down, gastrointestinal tract, start living there, make more babies, make more eggs, poop out eggs, repeat, repeat, repeat. Generally speaking, that idea of pooping out eggs and eggs reinfect is generally is the same for all of these. And then we have the non-intestinal nematodes. So these are called our flukes, or not nematodes, non-intestinal parasites, our flukes. We've got two main ones we have to focus on in South Africa. So Schistosoma hematobium and Schistosoma mansoni. So the disease they cause is bilharzia. And you guys have probably heard of bilharzia before. So the hematobium one is the one that wants to live in your bladder, and the mansoni one is the one that wants to live in your gastrointestinal tract. And then here they lay eggs, etc. So the one big difference from these ones is that they're not actually quite so big, and also they spread from a particular species of snail. So the snail itself is a middle carrier or a carrier of this disease, and now it takes these flukes, these eggs, and puts them everywhere in certain areas of the world, or certain dams and rivers, etc. And then from there, if you eat some of those, or you accidentally ingest some of them, you actually get the same disease once again. But then once again, you have to go around the cycle. On the other end of the cycle, you have to poop out an egg. So once again, it goes back to the pooping of eggs. You have to poop out these eggs, and your poop has to be in the area, and people have to be close to your poop to actually touch and eat. So it's not straightforward. It is straightforward. All of them work more or less the same way. Nothing else I really want to mention there. And then we have a few weird ones. So you guys have probably seen this loa, the one that actually lives in your eyes. So these are called our tissue roundworms or tissue nematodes. We have various forms of them. We don't really have a lot of them in South Africa, so count us lucky. Just a few examples on the image here. Dracula medinesis. That's the one you have inside your leg here, and you actually have to drag it out. Don't ask me how it actually gets there. We don't have so much in South Africa that I've actually ever paid too much attention to it. Most interesting ones for me will always be this Wuchereria bancrofti. So Wuchereria bancrofti is the worm that penetrates your lymph nodes and your lymph system, and then it causes, over a very long period of time, it causes your body to leak out fluid from the lymph system into the interstitial spaces. So the interstitial spaces will be basically everything surrounding the lymph system. And for some reason, in men it's the groin, and for women it's the legs and butt. But then you start building up edema. So that's actually just a lot of edema that this person has. And it continues and continues and continues as these Wuchereria bancrofti, these parasites, continue growing and growing and growing inside the lymph system. And then you get more and more fluid spilling out over from the lymph system into the interstitial spaces. Okay, interesting thing about this, it's spread by mosquitoes. So mosquitoes actually carry Wuchereria bancrofti and give you this. And then you've seen a lot of these stories, I'm guessing. It's the disease name itself is elephantitis. But basically it's caused by a tiny parasite living in your lymph system. And once you have reached this stage, you can't reverse it. So the idea is to kill the parasite in the lymph system far before it reaches this stage. Okay. But yeah, these ones, we don't really get them in South Africa so much, thank God. Okay, so how does our anti-helmintic drug therapies actually work? So most of the time, they actually only act by paralyzing the parasite. So they can paralyze the parasite or they can kill the parasite, etc. But most of the time, we try to paralyze the parasite so our gastrointestinal tract can poop it out or get rid of it, expel it. So we can do this by changing its immune system, by changing or suppressing its central nervous system, or I'm not sure if it's actually central nervous system for it, but we can put them to sleep. Or we can do this by altering their metabolism itself, so kind of starving them. So in all cases, we're trying to paralyze them. What else do I really want to mention here? Not sure. Let me just double check and I'll come back. Okay, so there wasn't really much I wanted to mention anymore on this level here, on this slide here. So they are slightly different, these worms, so not all drugs work exactly, not all drugs, it's not like a one size fits all mebendazole for everything. And you'll see in the pharmacy, the only thing that we really have to deal with at the back there is mebendazole and albendazole, and we use those for most of the cases. But it's not applicable for all the cases. So if you have a neurocysticercosis, like meaning you have a bit of the tapeworm in your head somewhere, or you have some cysts forming somewhere else, you can't use something like albendazole or mebendazole. Then you need something like praziquantel. And I'll get into that a little bit just now. But I have a little nice list for you here, and this nice little list gives you an idea of what you should use in what case. And how do we know it's a pinworm? How do we know it's a whipworm? How do we know it's a hookworm? You need, well, at least you don't do it, but you actually need a stool sample containing some of the worm, and then you have to look at them through a microscope, and then you can see their shape. Well, I'm lying in a certain sense here. Something like Interobius maybe, but a lot of them are big, so you'll actually be able to see them with your naked eye. So you can do like a macroscopic inspection of the stool, and you should be able to see them. You might be able to see some of the little eggs and cysts, and the eggs and cysts actually differ between them, and they look different. So you can actually use the egg or the cyst to identify which one is which one. So I didn't include a lot of images here, but I don't really feel it's for for pharmacists to know all of that. It really is more of a lab technician kind of aspect to it. So looking at what egg to determine what worm it is not really our thing. I wouldn't want to have poop in and then mix and then put on a dish, and I don't imagine any of us want to do that. Okay, so let's get to the drugs. So the first drug that we're going to look at is the benzimidazoles. So these are the most commonly used ones in South Africa. Specifically mebendazole and albendazole. The one you'll be giving in the pharmacy over the counter is mebendazole. That's Schedule 2 as far as I can remember it. You have a single dose or you have a 3-day therapy dose. We'll discuss which one is better. I think, I haven't actually checked this up evidence-wise, but in my mind, mebendazole is probably the better one. And the reason being is that they basically inhibit the virus from taking up glucose. So it's basically like making the virus a diabetic. So if we make the virus, not the virus, oh my word, the parasite. If we make the parasite a diabetic, even if you're a diabetic as a person, it's not like it's all of the problems come all at one shot. It builds up. So if you're a diabetic and you have zero control over your diabetes for a few days, then it gets much worse than having zero control over one day. Okay, but that's just kind of an assumption from me. Don't really take me on that one there. But we do have the two courses. The one is a single dose. The one is a 3-day altering dose. In my mind, the 3-day altering dose would probably be the best one. And then we have very low absorption with the benzimidazole, so you actually have to take it with a fatty meal, because fatty meals increase their absorption. And the bioavailability is only around 10%, so it's extremely low. Okay. Another thing I wanted to mention here is when you actually give this to the worm, it's not like the worm will necessarily die. It can become weakened, and it might lose its grip, its little grip with its little what do you call it, fangs, and its little suckers. Some of them have suckers, some of them have claws, some of them have a combination of both. So as they become weakened and they lose their grip, that's when you want to get them expelled. So if your course stops and you don't actually get them expelled, they might still remain behind in the gastrointestinal tract, and that's where you have a lower cure rate. So that's where the 60% comes in. More pronounced with other drugs. I think in some sense, a lot of if you completely stop the worm itself from getting glucose into its body or using it for cellular reactions, cellular actions, you probably do end up killing it with time. But in most cases, Not in most cases. In a lot of cases, you might not end up killing it, and if you did not expel it when it actually let its grip go, then you probably will get a not a reinfection, but there's a reactivation, or it'll just wake up again and start biting and eating again. So unwanted effects is not really anything major I want to mention. Unsuitable for pregnant women and children less than 2 years old. So benazole. So I'm guessing albendazole is more acceptable. So the next one we use a lot is piperazine. So piperazine is mostly used for Ascaris lumbricoides and Enterobis vermicularis. And just before I go too far, I don't expect you guys to know all of the names. There's just too many of them. I don't expect you to know all the names. I don't expect you to know exactly what drug works exactly for what parasite. Much like myself, I would expect you to be able to just quickly go up, look at the most likely case scenario and the most likely fit, and then from there you should be fine. But I don't expect you to know exactly word for word everything. I do expect you to kind of have an idea of how all of it fits together. So how the lack of hygiene ends up becoming the main thing that spreads the parasite. Okay. So what piperazine does is it mimics GABA. And you guys don't know what GABA is yet because you haven't done your, or maybe you do from previous modules, but GABA is basically one of the neurotransmitters that has to do with relaxation or with suppression. So suppressing, what do you call it, neuronal activity happens through GABA because GABA opens, if GABA is bound and activated, it opens chloride channels. So chloride comes into cells and hyperpolarizes them, so action potentials then stop. So obviously, if we do this, the idea is to paralyze the worm. So if we can get the worm paralyzed, then we can get it expelled. So and when you use piperazine, it's useless to use piperazine alone. You have to use it with something like a laxative. Otherwise, the worm will just wake up again. Also, to mention it this way, when you drink a lot of alcohol, alcohol also stimulates the GABA receptor and also gives central nervous system depression, much like the benzodiazepines do. Ooh, I'm going too far. But that's basically on the GABA receptor itself. So alcohol itself can stimulate the GABA receptor and it can cause chloride ions to enter into your central nervous system, your neurons, and then you get central nervous system depression. So it's basically like making the parasite extremely drunk until it passes out. And then when the parasite is passed out, you want to get it expelled. So that's when you have to use the laxative. Otherwise, it will just stay behind. Okay, that is the main thing I want to use there. I'll tell you guys there. I don't think there is something else. I just want to explain to you how piperazine actually works and how it's effective. All of the unwanted effects, etc. I won't really go into. These aren't drugs that you'll be taking every single day for the rest of your life. So all of the side effects in my mind are kind of minor. So not something I really want to focus on at all. Okay. I've got another little list for you here. I can't actually remember when I got this one from. It's a bit too long now. But here is a example of what you use for what. So just to give you a little bit more detail there. And once again, I don't expect you to memorize this. Please don't memorize this. You're going to waste so much of your time. I just want you guys to know that there is different ones and they get different treatments. And that's by far the most important. And yeah, I think that's what I can tell you guys. What more do I want to tell you here? I can see a few things that are interesting, but I don't want to go over interesting things with you guys for no reason. I think you have enough work at the moment. Okay. Okay, praziquantal is our next one. This is really one of our favorites because this is actually one that kills most of the worms. And the mechanism how it actually kills a worm, I have it on the next slide. So there's 3 different proposed mechanisms. Which one is the real one? Not sure. It's also the only one that's effective for the cystosarcosis. So the only one that's effective for the cysts in different parts of the body is to actually kill those cysts. Okay, that's what I want to mention there. The praziquantal is probably our broadest one that we actually have. It works in the most cases. I'm not sure between albendazole, mebendazole, praziquantal, which one is most broad, but praziquantal is quite broad. So praziquantal is also one of the drugs that we use for the cystosarcosis, and there's a little bit of a problem here because the mechanism doesn't really fit that side. Let me just explain to you why. So the idea behind praziquantal is that it actually enhances the flow, enhances the uptake of calcium into different muscular cells, and this leads to the parasite becoming, well, eventually paralyzed, much like the mechanism behind succinylmetonium. I hope you can remember succinylmetonium. Succinylmetonium was a neuromuscular agonist. So it bound to this receptor, bound to a neuromuscular receptor, nicotinic receptor on the muscle, stimulated it until you got insane contractions, and then after your muscles are completely depleted, or they completely, well, what's the right word? Let's just say depleted. They just relax. So the idea behind praziquantel is that it works much in the same way. So we force the contraction of the little worm, and then after it had this massive muscle contraction, it becomes paralyzed. So after it's paralyzed, then we can actually get it out of the system. So that makes sense. It doesn't make sense how praziquantel is then so effective for cysts themselves. So I don't have any explanation for that. And in some cases, this massive contraction of the muscle can even lead to worm death. So I think that's the mechanism. I don't really have the mechanism for why it's so effective in cystic cirrhosis, but I think that's good enough. And I wouldn't ask you guys to actually know something I don't know myself. Okay. Side effect wise, not really many I want to mention there. If you have a lot of side effects, it's much more likely that it's because of a massive amount of worms dying or becoming paralyzed inside of the gastrointestinal tract. Yeah, I don't really want to mention any of the side effects. Very rapid metabolism, not so really important. Oh, this is one important one. This is one of the safer drugs to use in pregnancy and in lactating women. So something to remember there. Then the next drug is ivermectin. So ivermectin is used for a lot of filarial infections. So the filarial infections we're referring to Wuchereria bancrofti and a few other ones. But Wuchereria bancrofti, like I told you guys previously, not really in South Africa, so it's not really so important. Um, it's actually commonly used in all of the dogs and the cats. I think I'm not sure about the cats, but in their little preparations we get ivermectin in there a lot. And of course, a lot of the drugs we use for cats and dogs, worms, are similar to humans as well. It probably has to do with the testing as well, because when we were testing drugs, we tested in animals first before we went over to humans, especially back in the day. So, no real surprise. So, ivermectin has three proposed mechanisms behind it. So, the one that makes the most sense to me is that it binds to the GABA receptors and stimulates them. Because if you stimulate the GABA receptors, you get what do you call it? Not proliferation. You get depolarization on the other side. You get hyper. Oh my word! How can I not remember that name? When you completely depress an action potential. What's the opposite of that one again? Ooh, how can I not remember that? Okay, anyways, I'll go get to that one just now. Oh my word, I can't remember. I can't believe. Anyways, let me just quickly remember that, and I'll come back. We all have a lot of brain farts. It's called hyperpolarization. So when you have hyperpolarization, you are basically suppressing the neuronal system from conducting any messages. So that's one of the proposed mechanisms of ivermectin. So if you bind to GABA, you would lead to more chloride actually entering into the neurons, and if more chloride enters into the neurons, you get hyperpolarization. And if you get hyperpolarization, signals can't be conducted anymore. Same in humans. If you were to give a person too much of a drug that can cause hyperpolarization, you get complete depression of the central nervous system. If you get complete depression of the central nervous system, you won't get any breathing, you won't get anything happening. So then death. So that's one of the mechanisms. Also, before death, you do get complete paralysis. So that could also be one of the proposed. That's also a likely explanation for how it actually gets rid of the worms, if you can paralyze the worm itself. So this also fits with the other mechanism here. So the kills the worms by opening glutamate-gated chloride ions, chloride channels. So same idea. So if you get more chloride into the little, what do you call this thing? Into the little parasite, into the little worm, then you can get it paralyzed. And interestingly, glutamate is connected to the calcium channels, much like GABA is connected to the calcium channels in humans. So, but this is more specific for these little invertebrates, meaning like these little worms. And then the last mechanism I had here, yeah, the last mechanism doesn't make, it makes less sense than the other two mechanisms. So I would be happy if you guys rather just stick with the first two mechanisms. Maybe I should just, for argument's sake, do this to make your own life easier. Yes, I like that one more. So, anyways, it is just proposed mechanisms, so I would not be too concerned about you guys not knowing exact one. Anyways, unwanted side effects, not really many I want to comment on there or mention. One interesting thing here is you can see it works for Enterobius vermicularis, which is the one that causes the itchy butt or the perianal itching, and the one that infects the entire family all at once. So that's something to remember as well. Um, I think I've mentioned enough about the tapeworms earlier. I don't actually want to do any more of that. I do have a little list for you here that you can use at any time to just have an idea what to use in what case. Uh, I maybe want to mention this Echinococcus granulosus. It's very rare to actually see it, but I think I did actually see a few of them back in the day. Anyways, I'll just mention it shortly. Anyway, yeah, I've got a few images here just for interest sake. A lot of these actually break down to become little cysts, and this is what Taenia saginata actually looks like. And they get really long. They get up to 3 meters in your gastrointestinal tract. So they basically spiral out of control in there. So that's what Taenia saginata does. Solium itself goes everywhere in the system where it can. So this is the head of solium. Oh, wait, actually, I can't remember which one is the head. Because one is saginata, one is solium. I can't remember which one is which one. But then your solium can actually enter into your brain and cause these neurocysticercosis. So basically, it can go lie eggs in your brain, which is insane if you think about it. And in this case, praziquantel is effective. But I'm not sure about actually removing these, actually getting the dead material of the cysts out of your brain. I can't remember that part, how we actually deal with that. But as soon as you get to this part, it's not a simple disease anymore. It's a complicated disease. And you get epilepsy, and your chances of getting cancer is much, much higher, etc. So this little guy here, Echinococcus granulosus, is actually a parasite found in sheep. And for some reason, when it shoots over to humans, we become the um, cul-de-sac environment. Let's just say environment. As soon as it's in a human, it starts growing and growing and growing. It becomes this massive cyst, and this cyst itself is where they just continue piling up and making more of themselves. So like copulating and growing until you actually have this massive, massive cyst. And when the cyst bursts, you get complete sepsis. Much like the sepsis you get in pneumonia or the sepsis you get in a massive infection of COVID. So that sepsis you get is what actually kills you. And we call it a cul-de-sac parasite because it actually inhibits its own life. It doesn't actually, we can't poop it out. It doesn't continue going. As soon as we get it from a sheep or something, it stays within us and actually eventually will eventually kill us as well. Well, if it's not treated correctly. And then if you want to remove this cyst, you have to do it surgically. And then if you have this little cyst of all the viruses in, not the virus, the parasite inside, if you remove it and you make a mistake and you puncture it and it flows out into the abdomen or into wherever it actually started laying or making the cyst, you can still get a septic reaction. So very difficult to treat. At least there's not a lot of those cases in South Africa. Okay. Uh, Once again, all of them generally have the same rules. So it's hygienic measures, most of them. That's how we got them in the first case, and that's how we stopped the spread of them. Getting a working sewage system working, that's probably the number one priority in all of the cases. Or it could be that um, there's some raw sewage somewhere or been there for a long, or was there a long time ago. You can't actually even smell it anymore, and now the little cysts and little eggs remain, but you don't actually know that. So washing hands before and after going to the toilet, all of that's part of it. Changing your underwear if you have something like Enterobus vermicularis, those little parasites, the eggs of those parasites stay everywhere. So even if you remove your underwear and you just want to shake it around and throw it around a little bit, you're actually spreading those little eggs everywhere into the atmosphere. And then people breathe it in, like I told you guys earlier. Um, and then of course, wait, hold on. Proper cleansing of the perianal area to protect children from anal finger and mouth transmission. I think the best idea would be to get treatment as fast as possible because, even if you do cleanse it, how do you actually not get the worms going back there again the next night? So yes, no, treatment is the first thing and prevention is the first thing. I don't think as soon as you actually have the parasite, there's much you can do. But these are one of the guidelines you will read. How do you actually do it in real life? Not sure. Regular vacuum cleaning if you can, and then keep fingernails cut short. That's kind of crazy if you think about it, because in other words, they're saying that if you did deal with um, dirty matter or soil on the outside, these little worms can stay behind beneath your fingernails, so you can still infect yourself with them later. So, and of course, if you have Enterobus vermicularis and you're scratching your butt, you're getting the worm below your little finger, your fingernail, so then you can infect yourself or someone else with it later. Okay. So the thing is, if you have a worm somewhere in the family, the idea is to treat the entire family for it. And then after about 14 days, you really actually should recheck, because a lot of the cases you only have a success rate of 60%, so those 40% of the cases you would still want to recheck. Um, oh, of course, if a person has intestinal obstruction, so such a massive amount of worms that they actually can't go to the toilet anymore, then you need to refer them. In that case, it's becoming a surgical problem. Yes, and I think the only one we have left is niclosamide. I think the spelling is wrong here. Anyways, what was the mechanism behind this one again? It had to do with, it had to do with the electron transport chain, and everything the electron transport chain. I still made the argument, how can it possibly work in a virus if the virus doesn't actually have an electron transport chain to actually act on? So still same thing in my mind. I don't think it can work for the coronavirus at all. So not much possibilities there. And then there's a few uses for it, not really widely used at all. So it's not really something I want to go into too much. And then there's the life cycle of Schistosomia imetobium or Schistosomia mansoni. So one more thing I want to mention is I saw this morning that there is new evidence or new ideas around ivermectin being used to treat coronavirus. I saw that this morning. I'll just double check it again before I get back to the protozoal agents, and then in the protozoal agents I hopefully can go into it quickly. Okay, that covers the anti-helmintics and what I want you to know. So we've covered not really too many drugs. There are a lot of viruses, but I don't expect you to know all of these viruses by hand. So really, I expect you to understand the idea of where all of these come from, the normal life cycle, in like a general life cycle, meaning poop, accidental eating, going into the stomach or going into the gastrointestinal tract, regrowing, poop, and the entire time we're repeating the same cycle. If you can understand that cycle, or something along that cycle, maybe a bit more detail than I just did it, I'll be happy. And that's more or less the most important. And then, in a broad sense, I want you to understand how the drugs work. So the drugs mostly act by paralyzing the worm, or causing the worm to become. No, it's mostly paralyzing the worm. Oh, or starving the worm by removing glucose absorption or taking glucose. By inhibiting its glucose uptake, so then it can't actually get glucose absorbed into its cells for energy. So then you completely starve the worm. So there's a few mechanisms. I want you to more or less understand the mechanisms and how they work, and then I think that's it. It's not too much to ask, because now at this stage there's no ways you guys can memorize all of this, and I don't want you guys to memorize everything like crazy parrots. Anyways, let's say that's the end of the Helmintic then.